If your child constantly complains about itchy, burning eyes, and you've tried the usual eye drops without luck, you need to hear this. Because dry eye in kids aren't just about irritation. Left unchecked, they can affect long-term eye health. I'm Syafiq, an optometrist and myopia care practitioner, and I've spent more than 12 years working with families whose kids struggle with eye issues. I've seen firsthand how dry eyes can turn into a daily battle for both parents and children. In this video, I'll show you exactly why there's an increase in kids experiencing dry eyes and how to go about eliminating these common triggers. Let's get into it. Let's start with the uncomfortable truth. Dry eyes in children used to be rare, but now we're seeing patients presenting with the problems multiple times a week. Why? Because three things have changed. First, screen exposure has exploded for kids. Think about your child's typical day and the newer online formats at school. Then they come home and complete their homework on the laptop and have some downtime on YouTube or their favorite gaming console. Suddenly, their eyes are working overtime, and here's what happens. When we stare at screens, we blink about 60% less than normal, which means the tear film on the eye surface isn't refreshing properly. It's like leaving a puddle of water under the sun. It evaporates faster than it's replaced. Second, indoor environments are drier than ever, with air conditioning, heating, and even ceiling fans all pulling moisture from the air around us. In fact, this is one of those invisible factors that parents rarely consider. Third, inflammation is on the rise, and poor eyelid hygiene, allergens, and even certain foods can trigger inflammatory responses that reduce tear quality. Your child might be producing tears, but if those tears evaporate too quickly or don't spread evenly, dry eye symptoms show up anyway. Now, here's the part that frustrates parents the most. You try regular eye drops from the supermarket and they help for an hour, but then the dryness comes back. That's because most of those drops contain preservative, and if you're using them more than 3 or 4 times a day, those preservatives can actually irritate the eye surface. In the end, you inadvertently make the problem worse. So what should you do instead? That's exactly what we're covering next. The first level of treatment parents should try is what I call the 3 habits. In mild to moderate cases, making tweaks to these 3 habits result in big improvements for your child. Let's take a look at them more closely. Habit 1 is screen time structure. You don't need to ban screens completely. You've probably heard of the 20-20-20 rule, which says every 20 minutes, look at something 20 feet away for 20 seconds. I actually modify this slightly because I find it's a bit impractical for most families. Instead of every 20 minutes, I recommend a natural break approach. Every 30 to 45 minutes of close work, encourage your child to look out a window or go outside for just a few minutes. This gives their eyes a chance to blink fully and reset the tear film. The key here is making it sustainable for your family. Habit 2 is environmental optimization. If your child studies or games in a room with air conditioning or a fan, I always recommend repositioning the airflow. This is because direct air across the face speeds up the tear evaporation, and redirecting it away from their face can help significantly. It can also be helpful to get a desktop humidifier, especially during winter when heating dries out indoor air. Now, it's best to try and achieve 40 to 50% humidity in your home, because anything below 30% can worsen the dry eye symptoms. Now, habit 3 is to purchase preservative-free eye drops. Out of any of these habits, this one is the most important. If you're going to use eye drops, they must be preservative-free. I also recommend looking for eye drops that comes in single-use vials instead of bottles. 2 brands I recommend for kids are Hyalofort and Catronol, which are designed to mimic natural tears and can be used as often as needed without causing irritation. My biggest tip here is to use them proactively instead of just when symptoms flare up. This means morning, after school, dinner time, and bedtime as a baseline, and then add more if your child complains of dryness during the day. Start with these 3 habits for a month and track the symptoms. If your child's eyes noticeably improve, you've probably caught it early. If not, we'll move to the next level of treatment. The second level is where we add more targeted interventions. These work for moderate to persistent cases where making changes to the 3 habits alone isn't enough. Let's look at what these interventions are and how you can implement them. Treatment number 1 is to use warm compresses and maintain eyelid hygiene. Dry eyes often stem from the blocked oil glands in the eyelid. These glands produce the oily layer of the tears and prevent evaporation. When they're clogged, tears evaporate too quickly. So here's what you do. Use a warm damp cloth, or even better, a microwavable heat pack, since it retains heat more effectively, and hold it over your child's closed eye for about 10 minutes each morning and night. The heat melts the oil in the glands, allowing them to function properly. Follow that with a gentle eyelid massage by rubbing along the lash line in small circles. For kids who struggle with this routine, heated eye mask can be a game changer by maintaining consistent warmth. The second targeted treatment is taking omega-3 supplements. Research shows that omega-3 fatty acids improves the quality of the oily layer in the tears by making the oil more fluid and less likely to clog the glands. It also prevents tear evaporation. A child who takes omega-3 supplements daily for at least 3 months generally sees a noticeable improvement afterwards. If you do decide to go down this route, look for supplements with EPA and DHA, the active forms your body actually uses. The third treatment is to identify hidden triggers. Sometimes dry eyes are worsened by underlying health conditions like allergies, eczema, or even certain medications. All of these are known to reduce tear production and sometimes increase inflammation. And if your child has seasonal allergies, managing them aggressively often improves dry eye symptoms. For these cases, antihistamines eye drops or nasal sprays can reduce the inflammatory load on the eyes. If you've implemented these level 2 treatments for 4 to 6 weeks and symptoms persist or even worsen, it's time to see a specialist. This third level is designed for cases that are severe or highly resistant, using clinical treatments that require professional guidance. Let me show you what these look like and what you can expect. Number 1, prescription anti-inflammatory eye drops. For children with significant inflammation, optometrists or ophthalmologists may prescribe anti-inflammatory eye drops. This works by targeting the immune response that's causing tear film instability. But it's important to understand that these drops are not a quick fix. Most prescription drops take several weeks to show full effect, and they can sometimes cause temporary stinging. However, for kids with chronic dry eye, they can be life-changing. Number 2, punctal plugs. These tiny devices are inserted into the tear ducts to slow drainage, keeping tears on the eye surface longer. It sounds invasive, but it's quick, painless, and reversible. Think of it like putting a stopper in a sink so water doesn't drain as fast. Number 3 is to treat the underlying conditions. Sometimes dry eye are a symptom of something bigger. For example, conditions like Sjogren's syndrome and autoimmune disorder may cause severe dry eye in children. If standard treatments aren't working, a comprehensive medical evaluation is generally recommended. This is rare but worth mentioning. If your child's dry eye comes with other symptoms like joint pain, chronic fatigue, or mouth dryness, flag them with your doctor immediately. So now you have a 3-level action plan to help you solve your child's dry eyes. Level 1, start with the 3 habits. Remember, those are screen breaks, environmental adjustment, and preservative-free eye drops. Give it 2 weeks and track the progress. Level 2. If symptoms persist, try a warm compress, omega-3s, and address any allergies. Level 3. If the problem hasn't resolved itself after a month of these treatments, book an appointment with an optometrist who specializes in dry eye management for kids. The biggest mistake parents make is waiting too long or jumping straight into random products without a system. The truth is, dry eyes are manageable, but you need a structured approach. And now you have one. If you found this helpful and want to connect with other parents navigating their kids' eye health, I've got a community called Healthy Kids Community where we talk about vision care, screen time, sleep, and more. The link is in the description down below. Thanks for watching and see you in the next one. Bye-bye.